So good evening, everybody. CCC is really excited to have a very special guest tonight, Amanda Luterman, a psychotherapist and founder of Center for Erotic Empathy, based in Montreal. You can visit the website at www.eroticempathy.ca. So Amanda's here with us this evening to talk about an incredibly important topic, intimacy and cancer. A topic that is not widely discussed, certainly in the medical world, but it's high time we started to discuss these things. And as Amanda will explain to us, is so very much tied to our mental health and wellness. So without further ado, I present you Amanda Luterman. Thanks for being here.
Thank you for inviting me. I am thrilled to help share in spreading healthy information and evidence-based information about sexuality and eroticism, and particularly in populations who are not well or who are struggling physically. It's certainly something that it's hard to feel sexy when you don't feel healthy, and that is a topic that is it's not easily talked about, and unfortunately people feel uninvited to the conversation of desire, really just somehow don't feel actively, almost similar to ageism, for example. You just don't feel like you're invited to the table, invited to the party, and so I want to make it clear that that's not true, and it's really important to continue to put the efforts into that category of life, into that very valid and vital part of mental health, particularly when you're struggling with illness and when your couple is involves two people also who are not both ill, right? And who are not both
Very true.
struggling.
Very true.
There is a loss of vitality and eroticism and just wellness, the experience of connectedness, the experience of wellness that comes from feeling connected, that is lost when a couple is diagnosed with cancer. It is a couple, just like by people say, we are pregnant, we have cancer as a couple, is sometimes something that I don't think has caught on very well, but is really true, particularly when it comes to sexuality and eroticism. So we'll get into it.
True. It's so true. And there's so many like really interesting points that you bring up, and, connectivity and, certainly cancer and disconnecting from one's body during the cancer treatment. So hopefully we'll get into to discussing how to reconnect to one's, intimate self. But before we delve into all this fun stuff, I just want to sort of set the stage a little bit. For erotic therapy, erotic empathy. I mean, I guess it's kind of all the same stuff, right? Mm-hmm. But how does when we were talking a little while ago, you mentioned how erotic empathy differs from your traditional sex therapy. So can you give us a little bit of information on that?
Sure. So the majority, I should say, first of all, I introduce myself as a psychotherapist. I do not identify as a sex therapist, particularly in Quebec, where there's an order of sexologists. I'm not a sexologist. But what I do is I do the psychotherapy of eroticism, basically. I specialize in essentially the skill set that helps people express and feel desire and desirability in a couple, in a relationship. And sometimes there's no loss of libido, there may be no illness, there may be inevitably, in a sense, everything, all the stars are aligned. And yet even those couples who claim to be attracted to each other and to love each other still struggle to feel reliably aroused in the company of one another. People struggle to actually feel confident and not silly or awkward, initiating sex with a person who they know rationally wants them sexually. So sex and I will distinguish it from eroticism in just a moment. Sex, generally speaking, is something that is, I don't have to say this to everyone, we all know this, it's everywhere, and yet nobody's really that great at dialoguing it. We feel that it's for, those people over there, those gorgeous people who, maybe we see having sex, that it's for them and not for us normal folk who don't have abs and who don't look long and lean in swimwear. It's a struggle for the average person to get through feeling those moments where they feel unattractive. Now, feeling unwell and feeling, for example, the physical the brutal physical discomforts and you know, the yucky parts, the nitty gritty of cancer, is merits its own distinct erotic empathy. It merits its own distinct skill of dialogue. So one of the things I tend to say in my work is that as much as people think my job's super entertaining and that I teach everybody to, you know, have sex from the chandelier, at the end of the day, my job is in fact not that. So sorry to disappoint anybody who's listening.
You might be the one who's most disappointed.
That's right. It's not actually erotic therapy. No, it's just talk therapy. But what it really is in fact the opportunity to elevate the way you talk about sex to the way you talk about other things that you're comfortable talking about.
Yeah.
So, you know, I use food examples all the time, right?
Yeah.
I mean, if you and your partner made the most gourmet, delicious meal together, you've prepped, you've made it all day, or you've, you know, you thought yesterday, oh, you know what, we're gonna have that brisket we finished yesterday that was in, you know, that took however many hours it took to cook. We're gonna have that for dinner tonight. But then suddenly you get this craving for simple, lazy, like you just really want to pick up a poutine on the way home. And that's what you want for supper. You've got to be able to, you know, just say, I know we said we were going to have the brisket, but I have to be totally honest. You know what I really want? I really just want a poutine. And it's those marriages, those non-judgmental, you know, free-flowing dialogue couples where you can just say, like, you do, you just want a poutine. You know what? Let's do that and we'll do the brisket tomorrow. No harm done.
They're
Those
completely
couples,
open
yep,
and
like,
just,
so
you
what?
know,
Sure.
flexible and wanting to make each other sort of happy and meet each other's needs.
Yes. Those are the
But
couples who
yeah,
can do it, right? Those are the couples
yeah,
who can say, I know it's Saturday night and that we have an opportunity, the kids are asleep
yeah,
and that we're supposed to try to be sexual. You know, or the whomever, you know, whatever the case may be. The fact is, at that time, it needs to be okay to say, actually, I don't have the energy to do anything other than use my vibrator. Would you be there with me and just like touch me or caress me or give me kisses while I do that? Because that's all I have in me tonight. Would that
yeah,
be okay?
yeah,
Or would you like to stimulate yourself next to me and let me be there with you?
yeah.
And I can't participate, but I want to be sexual with you. I want to be there with you. I still want us to feel together in it.
And that's
That's
such a thing, right, Amanda? Like that's such a thing when it comes to something like cancer, or, you know, any disease really, where it alters sort of, you know, the dynamic, it alters the physical appearance, often of, you know, of the person suffering from it. It alters the role. I mean, the roles within the family, so many different things. And then, you know, it sounds to me like there's a lot of sort of just open communication in a couple like that, the most ideal. So when you have the overly complex addition of, you know, the cancer to
yes.
do with it, like how, I mean, how does this paradigm of yours, or erotic empathy, you know, help couples cope with the changes, those
Yes.
changes that occur through the treatments, and, you know, and how do the changes, and how the changes tend to impact the intimacy?
One of the key components of erotic empathy is establishing a very clear and transparent understanding of what each person needs in order to feel connected, in order to feel fulfilled. That may not be in order to have penetrative intercourse, or that may not be, you know, stereotypically speaking, fulfilling sexual acts completely. But what it does mean is there's a clear and transparent understanding about what works for each person. Those first few sessions that I have with people are really, really about um, me interviewing through a process of nitty gritty. Okay. For example, how do you experience your own sense? You know, how do you find bodily odor, for example, after a workout to be an absolute um, interruption for you, or you
Okay.
know, obstacle to being able to be intimate, right? Because you know that if
Okay.
one person is you know, turned off by something easily, you know, versus that exact turn off is a partner's fetish, right? It can be a difficulty in their couple that they may not talk about. So that's
Wow.
just
Yeah.
something. So conditions are huge. Now, the thing that, the stories I hear from partners who are going through cancer together. For example, I'm working with two gentlemen who, when one partner is receiving sexual attention, when a partner is receiving oral sex, for example, if the one who is not going through cancer is initiating a contact, okay, and I believe he's had rectal cancer specifically, then what happens is, if he's going to initiate, he's already putting the materials out on the bed so that his partner should not feel self-conscious about any leakage or any issues that may occur from the
Okay.
rectum.
Okay.
Like, if you're going to initiate sex, you don't just initiate sex and leave your partner with the
High and dry.
fears of high and dry, the fears of embarrassment, the fears of the inconvenience or the
Okay.
responsibility to cope. You
Okay.
discuss what's necessary in order to feel that you can work through that act without interruptions or severe self-consciousness. You
Yeah.
have the agreement that if, let's say, one partner is feeling, you're starting to feel your stomach is spasming a little bit, you're starting to get a little, the colon is getting a little uncomfortable, then you just squeeze his forearm, or touch his shoulder, and he
Safe
right away,
word
yeah,
kind of
safe
thing.
word, he backs off, you go to the bathroom, let's say, if that's necessary. And sometimes that's where it stops, because you're just
Yeah.
not comfortable. You've become activated internal, right? You get uncomfortable. And so, but then what you do is, when you come back, the person didn't get disappointed and walk off, or, the person then just goes, that was fun so far though. Right? Or you say, how was that for you? Is there something, did I go too fast? Did I get you too aroused too quickly? Do you think, like, what happened? You talk about something
Yeah.
that you can learn from, or something that was good. And so some of these amazingly, erotically empathic, you're empathizing with the other person's experience of what it was like to be an erotic person in that moment. And you are doing that back and forth. And so you're never making, you're working really hard. My clients work really hard to not create assumptions about what the other person is thinking, and
Yeah.
then get disappointed about what they're deciding the other person is thinking.
It's very interesting. What are some, how can couples maintain? I mean, because, like, again, we're talking about a bunch of different things. We're talking about maybe shyness, fear, a lot of different feelings that come up, which take the wind right out of everybody's sails, obviously. And add to that poor communication, possibly because you don't want to bring these things up. But how can couples maintain a level or a sense of intimacy? And again, I guess we're really delineating between, like, intimacy and sexual contact. Like, it's not always
No, of course.
part and parcel of the same thing. I think that's also a misnomer. But
Right.
how can when that sexual connection is so strained or so kind of like nebulous, like, what are things that people can do
Couples
to kind
can
of,
do.
yeah.
So, one of the most important things to say about sex and cancer is that, don't let the sex die because you're not having it. I would say
Okay.
that's one of the key things. So even if you're not able to be sexual with one another, we will talk about. I should answer that in a second. The thing about eroticism: because you're not having sex, or you're being sexually active together. Don't stop having conversations about sex. So one of the things
Okay.
couples can do is to continue, for example, to talk about their favorite times that they had sex. And that can be hard. There's grief work in there. It's like bereavement work. Sometimes you're not sure you're going to be sexual again.
Wow.
Um,
Yeah.
but
So
to be
true.
able to get into bed as though you were going to have sex, and talk about your favorite times, or describe how you feel desire today. Who did you find attractive? What was that? What kind of feelings did you have? Did you, when I touch your knee under the table when your friends were here, wasn't that kind of fun? It felt like old times. So trying to keep the eros, the vitality of the
Okay.
couple alive and well. And I think that that's the most important thing that keeps people feeling truly fulfilled in the darkest and scariest of times, because illness can also really can serve to connect a couple, right? You're feeling,
Just gonna say connection. Yeah.
yeah, connection. I mean, you
Yeah.
feel so bonded. You're going through the most personal experiences of bodily changes, and fears, and horrors, frankly. So it's really important to be able to notice that desire can still manifest without sex.
Yeah.
right? And that sex is not always intimate, actually. You can still try to, the couples, I should say this directly, the couples who, with whom there are non-intimate sex acts just to keep sex alive don't do nearly as well as the couples who maintain fulfilling conversations as they express desire to and from each other,
Yeah.
because that's sincere and intimate, and it's filling, it's satiating, it's loving, which sex and love don't always have to go together, but in a long-term couple, I'm assuming here, couples of any orientation, identity, polyamorous, monogamous, same sex, hetero, there's an essence of being seen in who you are as an erotic person that really contributes to mental health. So if you, for example, are, let's say, a dominant man, in bed, you're somebody who really likes to be provisionary. You like to sort of lean her down onto the bed, or him down onto the bed. You really are somebody who is a bit more dominant in their power, sexually speaking. And then you get rectal cancer, and suddenly you're afraid to leak from the bowels, or to, pass gas and to fill a room with stench, suddenly in the middle of sex, all these scary, horrible
It
things that
changes
are
your
not,
entire identity. Yeah.
they do not suit your composure.
Yeah.
They do not match who you are, but you're
Yeah.
experiencing this stuff. Then it is important in your couple that you thrive, continue to find those areas in which you are seen as a nurturing dominant, so that you don't end up, irritable and cranky and mean,
Yeah.
which can happen when you don't get to be who you are.
Yeah. I mean, the role reversal, right? That happens sometimes where,
Yeah.
you are more, like you said, of a provisionary person, but then you become the needer, the one who needs more. And so the roles switch,
You
but
become a
it's switched.
patient.
There you go.
When you're somebody who likes hosting and you become a patient, and you are suddenly receiving, and there's people tending to you, and you're the one who
Mhm.
really liked doing those things, it's those distinct aspects of identity that also particularly erotic empathy targets. I
Okay.
ask people to sketch me, who are you in your movie? What kind of character do you play in your life? And then we
And I
can
assume that
also,
changes when you have cancer
certainly,
or when you have any type of disease. Yeah.
it changes. Yes, it changes across life, generally speaking, right?
Right.
So as much as your erotic fantasies can change from, Chana, as we talked about, right, where let's say you meet your partner when you're a student, and so you
Yeah.
have more kind of egalitarian, playful fantasies and erotic play, and then suddenly, it's 22 years later, you're a partner in a law firm, and you're fantasizing your partner, tying your hands behind your back so that you don't have to do anything, because you do a lot all
You
the
do a
time.
lot. Yeah.
So you're fantasizing
So
these
true.
freedom from responsibility type fantasies. So eroticism, let me specify, sexuality is a medical word. It refers to one body. The sexuality of a body is its function to dysfunction range, okay? But your eroticism is about, essentially, it is your how you interact with desire, how you are evoked desire, and what makes you feel desirable. So eroticism is the interpersonal play between
It's not
two
the physical or the physiological as
No,
much.
I mean,
Yeah.
people identify, in a way it can be, but more than anything, we use it as the interpersonal sexuality. So
Right.
sexuality refers to one body, and eroticism is that evoked desire between two things. So you can say the stiletto is an erotic symbol because, it evokes desire. It makes people think of sex, for example. And so that eroticism, that nuance of flow, that dynamic between two people, typically speaking, is what can fall flat when a giant obstacle, just
Yeah.
interrupts the flow that was there. So when people talk about sexual chemistry, they're actually really referring to erotic dynamic, the erotic dynamic between a couple. So maybe there's, there could be there could be a paternal dynamic, let's say, a little bit. There could be a pursuer withdrawer. There could be all kinds of different dynamics. There are quite a few. I'm not going to go into all of that per se, but what's important to tap into is the skill set of expressing desire without needing to be sexual per se, and the idea that sexuality in its expression can also be made to be more fulfilling by including more skills of eroticism. And that's what I
Okay.
focus on in my work, is helping couples who are not necessarily able always to be sexual actually continue to manifest desire and eroticism in their relationship, continue to feel desirable, aroused, and no matter what the functionality of the body. And that's why we see in the study of eroticism, you typically see people, well into their 80s feeling, and 90s, nowadays, I think it used to be 70s and 80s is now 80s and 90s,
Yep.
feeling fulfilled as attractive human beings in their relationships.
So what did you go? Sorry, I missed I forgot the term. Tools of desire, or what did you just mentioned something of desire?
The dynamic, that
Yeah.
it's a flow between two people that I say is the flow of expression, and how we tend to be pretty, the field will call it reductionist about
Okay.
sex, that sex is referred to, like, for example, what is the term, what do people say when they're referring to a certain, penis in vagina sex? They call it penetrative orgasm, right? Oh, orgasm, penetrative intercourse,
Right.
right? Penetrative intercourse is, it assumes that there's something penetrating and somebody receiving. This
Yeah.
penetrative intercourse, it is so one-sided verb. It means that there's something moving towards something else. Now in Cancer, the best case scenario for many people who would be traditionally receiving, right? Gender across genders, whoever's receiving the act is also capable of doing what I call envelopment.
Okay.
So if you don't want to receive penetration, that you're not driving because you don't know your pain level, you may want to begin the act doing something that's called envelopment, where you let yourself envelop the penetration object, so to speak. You let yourself gradually raise your hips or lower your hips, or or have whatever, if it's anal or vaginal, or whatever the case may
guide.
be.
You're the
receive.
guide.
Yeah, you don't receive, you envelop. And why I say that is because for many people who are, for example, a little bit more dominant or a little bit more inclined to want to be on top from a submissive erotic standpoint, they don't they can't necessarily engage in the same stimulation as they used to. So we have to use different ideas to help gauge control, and particularly where there's pain. If that makes sense.
Yes, very much. You're sort of having the person lead the way and kind of guide the partner.
Yeah.
So there's less fear involved and less
And also you're
expectation,
taking a
maybe.
lot of responsibility off. Let's say a very common concern, because I do work with a lot of women and women-bodied people who have male partners with a penis that would like to penetrate them, right? So what happens there is, let's say the person with cancer is the female, then you've got a guy who's afraid to hurt her.
Yes.
And that's not a turn on, right?
No.
If he's feeling like he's a predator, or he's, just seen as this guy with this thing and he has to put it somewhere, and he doesn't feel,
the guilt too.
The guilt
How
is
could
not
I be
arousing.
feeling this way? Yeah.
Yes.
How can I feel this way when my partner's suffering or whatever?
That's right. And so what you want to do is, you don't necessarily, you got to change up your erotic story. The story isn't I want you and I'm taking you now. The story is come and get it. Because that way he's not hurting her.
So you're changing the narrative.
I'm changing the narrative. I use the term erotic narrative quite a bit. What is the erotic, what is the story of this sex that we're talking about that is blocked?
Okay. So do you, Amanda, do you then help, is part of your practice to help clients, couples, whatever, to reframe, to re-narrate their story type of thing?
Very much so.
Wow.
Very much so.
I like
that.
When
they often say that what used to arouse me doesn't work anymore. And I often hear what used to arouse her isn't working anymore. Or, very similar to postpartum psychology in a way. You feel rewired after cancer. You feel, what used to be arousing, what worked, you may not masturbate the same way.
Yeah.
No matter your body, your sex, male or female, in body, you will not necessarily feel that your musculature is the same. I always encourage people to work with pelvic floor physios, who can be really wonderful, right?
Well, actually, for a lot of post-surgical patients, rectal patients particularly, this is a huge, treatment. And okay, so in terms of erotic empathy, what does that provide? Like what?
In service, so specifically it is psychotherapy, again, having dialogue around the nature of facilitating conversations between two people who are distinctly different erotic humans. That is my goal. My goal is to help
Yeah.
people have just facilitate conversations that are difficult to have at home.
Okay.
And particularly because they're difficult to have at home, I always urge people to have at least a few sessions when going through rough times, because the conversations begin and end at a certain time. They don't go on for hours. They're boundary conversations. You'll get little bits of homework that are productive, that are
Okay.
reflective, and you'll be guided through the process that is very emotional and sometimes very frustrating, brings up old trauma, can be very triggering.
Yep.
So yeah, it's we're I'm trauma informed, queer friendly, and really the whole process of navigating tremendous body changes it does merit concern for one's mental health, and does merit some facilitation.
Okay. In your blogs and on your site, there's mention of erotic evolution. So like how to cope when one partner's sexual desires of functioning changes, which I guess we were just talking about, right?
Yes.
And rewriting the story. But are there maybe along the lines of some tips that you can impart potentially? I mean, again, the enveloping would be one of them. Some other kind of ideas to get people kind of talking and
Yeah.
changing their headspace.
I think one of the most practical tips I can offer is experiment with different sensations of pleasure. So
Okay.
across time, the body needs different things. People will talk to me oftentimes about how they used to be able to have an orgasm from what felt like a trickle of water. For example, it
Yeah.
may have taken a good,
Oh, the teens.
yes,
The
there you
teen
go. So
years.
people who, the water trickle, the orgasm from
Right.
the faucet, and how it just took, closed eyes and time,
Yeah.
but it was reliable. And then that stops working and you need more intense stimulation, or you need more erotic narrative, more psychological arousal. And so these are the kind, I mean, very, very normal evolution of sexual sensations. And eroticism being actually psychologically aroused by a particular storyline or by a particular power dynamic is very,
Yeah.
very helpful for escalating sensations of arousal. Never think that you're supposed to depend on mechanics purely.
Okay.
So, right, if you're not having sex that you are craving or wanting,
Yeah.
if you're not really wanting to be touched, you probably shouldn't be touched, even if you're just willing, because it could end up feeling kind of violated afterwards, particularly after all the medical trauma of being poked and
Oh,
prodded
that's the
and
thing,
not
right?
feeling.
And
Yeah. Yes.
disconnected, because essentially that's what cancer patients do, right?
Yes.
Or people undergoing treatments, they disconnect from
They
themselves.
dissociate. They
Yeah.
dissociate from their body in order to have it be something their body was enduring, not them, which is a very
Yeah.
similar wiring to sexual assault. So that's why I say
Wow.
never have sex you're willing to have, only have sex you want, sexual touch you want,
Okay.
because it is absolutely synonymous, with feeling violated and feeling that something is happening to you that you don't want happening. So if you're
Yeah.
somebody watching this and you're resuming your sexuality post-treatment, for example, you really want to make sure that you go about it when you really are wanting to be touched. Don't start with sex right away or anything. Start with just wanting to be touched, and then say, okay, that's enough. I've had enough, thank you, and
Keep them wanting
move,
more.
and then keep them wanting more, or decide that
Yeah.
was safe.
Yeah.
I don't,
Yeah.
it was good, I'm going to stop there. Like the couple I talked
Yeah.
about with regard to oral sex, where they had the quote unquote, certainly embarrassing physical imperfection, physical stuff happen, but
Yeah.
they actually just said, oh, but that was really fun at the beginning, and they stopped. They didn't try to push it to keep going just because they'd started. That's a success in this business. Okay.
Okay.
Doing something that feels good until it doesn't,
Doesn't.
or
Yeah.
until something, sometimes it's okay to keep going. He actually also has had cases where, I talk to many couples who they tell me, oh, but you know what? We took a minute, we like took a little break, a little wipe down or whatever, and just said, let's keep going. Let's try again. And that's okay too. So so going back to the practical stuff, trying different sensations, particularly depending on also your the impact of cancer on your sensations.
Yeah.
So for some people, vibration is not a good idea. Okay. For some
Okay.
people, vibration can be too rough
Okay.
On the very sensitive skin after chemo of the vulva, for example.
Okay.
Very,
Or
very sensitive.
radiation, the
Or
nerves.
radiation.
Yeah.
That's right. Very, very sensitive at
Okay.
first. I
Okay.
wouldn't try, it depends on the person and depends on what you're willing to try, but I would be careful of vibration, although it has its benefits to, work on, vibration can also activate some involuntary muscle contractions that are great for
Okay.
sexual play and strengthening and stuff like that. So that's, masturbation is always positive, but you just don't want to do it in a way that is hurt in any way painful at all.
Yeah.
Pain is never normal during sex. It can be normative, unfortunately, in that it's common, but it's not something that is normal. It's not something that we should accept. It's something you should always get medical advice about.
Okay.
Okay.
That's good to know.
So
Yeah.
something like looking at other sensations to build up some comfort and some muscle tone could be looking at sex tech. We don't even say sex toys anymore. We say sex tech nowadays. It's like,
Okay.
if you use an electric toothbrush, why not use, a vibrator kind of thing? Like, just incorporate convenience into your life. Okay. But there's so many different styles of sensation. There are
Yeah.
kinds now that there's something like a sonar style sex toy, sex tech, where you actually do not touch the skin at all,
Oh, wow.
but it emits a kind of pulsy style, like sort of sucky sensation on the clitoris, for example. Very, very, very satisfying. People talk about these things like with hilarity online. Okay, people
The
love this stuff.
womanizer,
The
those,
womanizer,
yeah,
there you
yeah.
go.
Right.
Stuff like
Yeah.
that. So for somebody who has some sensitivity of the skin, that can be a really interesting option.
Okay.
You don't.
Yeah.
So you can look at all kinds of different, see what's out there. There's new stuff coming out all the time. I'm a huge proponent of sex tech. I really believe that pleasure should be easily accessible and easily, what's the word? Can be carried out easily. Most
Okay.
people do not have the the cardio to manage the arm stamina sometimes to manage what they need, particularly after cancer.
Yeah.
Okay. I tend to joke you're going to run out of breath before you run out of erection. That's normal. It's okay.
The endurance is low.
Yeah.
It's
Endurance.
low.
And
Yeah.
I mean, especially, you're over 40 or whatever. It's something that is completely reasonable.
Yeah.
And you just want to be able to accept that and say, okay, what are we going to strategize here? How are we going to do this?
Wow. Really.
And the other thing there is natural oils. Obviously,
Yeah.
again, in terms of sensitivity to chemicals after chemo, radiation, stuff like that, you just really want to look at using natural oils. I like almond oil personally. I've always said that. I use it for myself postpartum, pre and post. Very, very safe, natural oil.
Okay.
It does. Oils are not good for latex, however, if you're using condoms, not good. But if you're open to using natural oil, olive oil, coconut oil, almond oil, very, very pro these things.
Wow.
Particularly
Okay.
also
These things.
just to add.
Yeah. No, I was
Yeah.
going to say, what's the impact on latex? They render it.
Yeah.
Not,
Oils weaken latex.
Okay.
If I can jump in here for a quick second,
Please.
one of the neat things, 100% oils will disintegrate the latex, but
That's the word.
there's really other options that are easily accessible. So if you want to use oils and are using condoms for whatever protection, you can use non-latex condoms, which are a form of plastic, like the isoprene. They're a little bit more expensive, but easily accessible. And then you can use whatever oil you want with it.
That's right. Yeah, they're polyurethane, or there are various. There's other stuff now too, I think, right? Yeah,
totally. So, but it's just to be mindful that it says non-latex. That's all, especially if you're using the condom to prevent against, a pregnancy that may not be planned or a sexually transmitted infection. Yeah.
And also latex can be abrasive again when the skin is so sensitive too. So that's always a positive option. Thank you, Stephanie.
Yeah, thanks. Okay, that's really great. So yeah, this is, I mean, really it's about, if I can kind of summarize, it's really about getting people to reconnect to their own erotic selves, or their own sexual selves. Definitely
the kind of what you're saying. Yeah, thank you for just bringing those words up here at the end, because I want to say what's important here is acknowledging there is an erotic self. That's what I hope people get out of listening to this. There is an erotic self. There is a part
at any stage,
at every and any stage of discomfort and of
Yeah.
fear and of helplessness, as well as all the positive times. There's an erotic self that doesn't only exist when you're healthy, and it doesn't only exist when you're, with yearning in a negative light. It's actually a part of you that, whether or not you're able to have physical sex is alive and well. And it's a part of you that your partner is probably very attracted to and wants to be seen by. And it doesn't mean that it is sex dependent. It means that touch and expressing of desirability and of importance is really, really huge. And the resentments and the rejection that are so characteristic of the kinds of time in which couples are forced to be in sexual disconnection. The resentments and the rejection are really in large part due to neglecting the erotic identities that need to continue to thrive and to be seen, even when the sexual body is betraying of that. So
it's like a muscle, right? You don't use it, you lose it. And it's not just the physical one. It's the, you're flexing your interpersonal sometimes.
If you don't use it, you get anxious or depressed. I mean, it's really the big message.
So true. It's so true. It's so true. The connection to mental health. I mean, it's this weird thing that, as you mentioned at the beginning, sex and cancer don't go together. You see it. It's almost like this, like how could somebody think about this in the time of? But in fact, I mean, in some form or another, it's probably what keeps a lot of people going. The closeness and, that intimacy between you and your partner, or you and yourself even.
Yeah.
I mean, you don't need a partner, right? Like,
and you're not,
these are the things that kind of,
Yeah, I was just going to jump in and tell you that, I think people need to feel that they, you're not guilty of neglecting your partner if you can't have sex. You're only ever guilty of not talking about the fact that you can't have sex. It needs to be talked about. And it needs, you need to be able to say, have you masturbated? Make sure you masturbate. If you don't want to do it in front of me, that's okay. But make sure you're taking care of yourself, because you don't get to stop being a sexual person just because I'm out of commission right now, for example.
It's also a part, I know you don't like the term self-care. I know you don't, but
no, I don't like self-love. It's the self-love.
Self-love. Okay.
Yes.
Okay. Self-care though, I mean,
other.
it's a part of the regimen, right? Like, I mean, and it's sort of like, I would assume that if you move, the further away you move, the further from it you move, further away from it you move, the less you feel that you're, that you have the right to it, or that you're a sex, right? Like you kind of, okay, well, I guess I'm just not that person anymore. I'm not worthy of it. I don't deserve it. Look at me with all, battle wounds here and whatever.
No, I mean, when people are on a good day, worrying about having abs and you have an ostomy bag, I mean, it's sort of,
right.
how does your mind even wrap around the idea that you are absolutely still a thriving erotic person? So do get make a professional appointment to help you understand that you can continue to harmonize and integrate who you are erotically, and how satisfying you actually satisfied you can actually feel by acknowledging that this is a valid and essential part of your health and well-being, even if it's hard to wrap your head around that at that time. That's my suggestion. Continue to value this part of yourself.
You value this part of yourself, find ways to enhance it, find new ways to discover it, because again, like you said, you don't want to end up in a worse position, and not, kind of not have that to, especially in a pandemic, right? Like here we are in a pandemic. What else are people doing? You're stuck at home. It's a really hard thing. I mean, this must just complicate things so much more. Having people sort of, the last thing I want to do is have a conversation with my partner. All I do is sit with them. But like you said, it's flipping the script, and it's it's changing sort of the narrative around it. So although it's more challenging now with being together all the time, I guess it's really something that we need professionals like yourselves to be doing things like this, and we need to be reaching out to you. So
the pandemic, it's true, the pandemic has definitely added that dimension of needing to have a conversation about how to navigate privacy while keeping, while maintaining dignity to sexuality in a partnership that's challenged, and struggling with cancer. I think that, having to have a conversation about how masturbation or just self-care in a sexual way does manifest in a relationship, and how it, is going to play out, needs to happen. Because if it's, I've always said that if sexuality is relegated to the bathroom, and that you sort of just take care of yourself in order to not hurt your partner's feelings, and honestly, there is a problem in your couple, and you are feeling it, because a romantic partnership is supposed to include some comfort around sexuality, or acknowledging of each other as sexual beings. And if that's not happening, then without a doubt, I promise you're both feeling sore about that. And it's worth just having a helped along conversation.
Wonderful. Well, Amanda,
Thank
this
you.
has been incredibly, incredibly eye-opening, and just like an exciting topic. And, my hope, especially, sadly, we're seeing a lot more cases of early age onset, under 50 colorectal cancer. And so, across the spectrum, the age spectrum, sex is important, but, we have very vital sexual beings, who are
Yes.
having all these changes happen. And I think that the more we kind of bring this out from the bathroom, and and from under the rug, after we've been sweeping it under there, we have to get healthcare professionals talking about it, and we have to kind of reduce the stigma that everybody has about it. So thank you for being part of that.
100%.
We're going to chip
Thank you for
away
having
at
me,
Amanda.
Yeah, thank you for inviting me, and it's an
Thank
honor.
you so much.
Yeah.
Okay, great. Have a great evening. Thank you so much.